Good evening. This is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. I am a senior advisor to the National Pain Council. If you wish to contact the National Pain Council, it's pretty easy. National Pain Council, all one word, at Gmail. Tonight we're going to start a series of brief news reports and comments from myself and the National Pain Council about the problem of people being taken off their pain medicines without their permission. This is a serious public health problem and is probably the worst public health problem we've had in the United States. The number of people being taken off their medicines in order to prevent addiction is 10 times larger than the number of people who are addicted. The CDC entered the game in March 2016, and unauthorized as they were, they published a CDC guideline for the treatment of chronic pain with opiates, or opioids as they say. The director of the gigantic agency, the CDC, which is the Communicable Disease Center, was Thomas Frieden, a physician who was previously in a political position in New York City, and he allowed a group of people with an extreme agenda into this government agency and allowed this group to basically write restrictive recommendations for the use of pain medicine. Pain medicine's been used since before the pyramids were built. If there was something wrong with it, it probably would have showed up by now. So we've got a real serious problem. The National Pain Council is researching the background because one thing they do not want to do, and I do not want to do as their advisor, is to say things that are not true. Thomas Frieden said a lot of things as the director of the CDC after he allowed a rogue extremist group into his agency. For example, on the day of the CDC guideline release, which was March 15th, 2016, he said, I quote, "The prescription drug overdose epidemic is doctor-driven by overprescribing opioids, largely for chronic pain, and is the key driver of America's drug overdose epidemic." That's not true. A physician director of a gigantic federal agency said things that were not true. There's no evidence that doctors are causing the opioid epidemic or opioid crisis or whatever you want to call it, which is the same crisis we've had for the past 50 years, which is people with heroin addiction dying in the streets without health care. It's not caused by doctors. The implication that Dr. Frieden was putting forth was the same implication from his advisors at the agency or the group called PROP, which is the Physicians for Responsible Opioid Prescribing. And basically, it's a group of 17 doctors who don't believe in using pain medicines. We're talking pain medicines here after your operations, pain medicines in the emergency room, and pain medicines for rare painful diseases, which are long-term persistent inflammatory diseases like CRPS, which is complex regional pain syndrome, or RSD, reflex sympathetic disease, adhesive arachnoiditis, pudendal neuritis, trigeminal neuritis, long host, the old diagnosis of fibromyalgia, which is now central pain syndrome, because the Mass General in Boston and the Karolinska Institute in Sweden found out that this disease, which was passed off as some woman's disease, was all in her head, actually is an inflammation of the brain. So these are diseases which the CDC was unaware of in searching their documents and searching their guidelines. These diseases are not mentioned. The only thing mentioned was low back pain. These diseases are not low back pain, let me tell you. And they need 24/7 treatment. And this was shown by Nora Volkow, head of the National Institute of Drug Abuse. Anyway, back to Dr. Frieden, 2016. So he makes this statement that doctors are responsible because they're overprescribing. So overprescribing is not a word we doctors use. What does it mean? Well, the federal prosecutors made up some definitions. They thought overprescribing was prescribing too much. Too much what? Too much to each person? Too much in the practice? Too much per week? Too much per year? Too much compared to a practice down the street, that a gynecology practice? There is no truth to the concept of overprescribing, but a doctor, head of a big federal agency, makes this statement. What are they going to think over there in the Department of Justice? They're lawyers and judges. So now they've heard the big guru, the doctor that runs the CDC, telling them that doctors have caused the overdose epidemic. So what would you do if you were a police officer? Arrest doctors. So doctors have been arrested because they're overprescribing. But that's not what the law says. The law is real clear. It says that you cannot illegally sell drugs. That's what drug trafficking is, selling drugs. But we're going to go into this a little bit more. It's a big topic. We're going to have some sessions on why was your doctor arrested. But back to Dr. Frieden. These are other quotes of his. Painkillers are just as addictive as heroin. Well, that's a little bit of a trick question, because heroin is actually a pain medicine. And it's an opioid, which is a bad word. It's an opioid pain medicine. And all opioids are pain medicines. And all pain medicines are opioids. So let's get rid of the word opioid and just start using the word pain medicine, because that's what they are. All pain medicines can cause addiction. You can maintain an addiction with any one of the opiate pain medicines, including heroin. Heroin is used simply because it's cheaper. Addicts that we've talked to would much prefer a prescription drug to maintain their addiction. And why are all these people overdosing and dying with this addiction disease? Because the United States government will not allow enough funds to be put out to treat the disease. But we'll get into that later in another session. We're going to put one of these out every Monday, if possible. Now, it's becoming clear that opioids carry substantial risks, but only certain benefits. Now, this is a little trick, because we doctors, whenever we treat somebody or give them medicine, we always balance the potential benefits against the potential side effects. If you've got a cold, then if you give somebody an antibiotic, that means the risks of the side effects of the antibiotic are greater than the cold, even though it's done routinely. So by tricking doctors reading this, which they felt were, as you know, part of the problem, there is no study that was done to show that pain medicines work in long-term disease. Therefore, it doesn't work. You can't do long-term studies. They're unethical. What are you going to have, a control group and a experimental group that runs on for a year? You can't do that. So that's false. For the vast majority of patients, we know serious and all too often fatal risks outweigh the unproven and transient benefits, and there are safer alternatives. There's no safer alternatives. That's not true. The fatal risks, there's almost no fatal risk when people are taking pain medicine. That's a Frieden myth. There are safer alternatives. No, that's not true. So Dr. Frieden has made a lot of comments on which we're going to publish. And the worst one is opioids should not be first-line treatment for chronic pain. That's not true. In medicine, we have what's called drug of choice. If you got a strep throat, the drug of choice is penicillin. The drug of choice and the only drug approved by the FDA for severe pain are pain medicines or opioid pain medicines. Thank you and good night.